and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here at the Oliver Wyman Health Innovation Summit. Delighted to bring our next guest, John Kao. John, welcome to the interview.
Thanks, Kate.
John is the president and CEO of Alignment Healthcare. So happy to have you. I know that we have a relationship through GuideWell with Alignment. So, John, your presentation tomorrow addresses how to really achieve population health. What are some of the points you're going to make?
Kate, the whole foundation for us is population health through collaboration, one person at a time. And so we fundamentally believe that having assimilation with hospital partners, assimilation with payer partners like Florida Blue, all working together with one common goal, which is taking care of seniors, saving lives, and improving health. And we're going to talk about how to actually do that with the core capabilities we think are important to accomplish that. One of which is going to be taking lots of data, big data, turning it into smart data, embedding that into clinical interventions that lead to better outcomes. So we'll be talking a lot about that.
You know, I think one thing that's so fascinating about your model is that you have a very high tech but also high touch model where you even have sensors in the home and it's all meant to really help that frail elderly lead a happier, more productive life. So I wondered if you wanted to talk a little bit about that.
Absolutely. I mean, there are 50 million seniors in this country. 50 million. Approximately 20% of that population you would characterize as having a frail or polychronic condition. That's 10 million people in this country. That population really, we believe, is underserved from a care coordination perspective. They are sick, and we think that what we do with delivery systems, with payers, actually helps save lives and improve health. And in many respects, the whole mission of the company is serving that group of people, because they need it the most.
Right. Well, that leads me to my next question. In reviewing some of the material to prepare for this interview, John, I was so fascinated to hear that you quoted that your innovative model is constantly learning. What are some of the ways that your model has improved on itself?
I got to tell you, it's a philosophy of clinical innovation. And the most recent evidence of that is what we call our command center. Every day, for every member, we get real-time data. We get pharmacy data, lab data, encounter information. We get authorization information. We get all the information we can real-time every day for that member. And so what happens is we can deliver the right care for the right patient in the right place at the right time. So every single day, every single minute, we have clinical people almost serving as an angel on our members' shoulders, looking out after them.
Right.
And so that process of just continuous improvement and continuous tracking of information for the benefit of our members, I think differentiates us in the market, which is why we're so important to work with the doctors and the hospital partners that deliver the care.
So you're lifting, by your efforts, you're lifting everybody in the health industry to be able to really keep that consumer right in the middle, which is what this whole summit is about.
You couldn't have said it better, Kate. I mean, we think we have the best hospitals in the world. We think we have the best doctors in the world. We have the best technology, the best carriers in the world. And so what we want to do is we want to assimilate into the delivery system and collaborate with them and the payers for the benefit of the consumer.
Okay, well, John, if that's such a hopeful and such a progressive idea through collaboration, we know obviously that there are still so many barriers that exist within the health industry from us to really be able to address the holistic needs, especially of this frail elderly population that Alignment addresses. So what are some of the ways that, some of the barriers that you think are still exist that help us, prevent us from delivering that kind of care?
It's time and training, and to give you an example, at the end of the day, the physicians, the practices have to transform. The physicians need to believe that this model of care coordination for the senior is good medicine. And it's working. For example, in our North Carolina operations, we had several hundred of our members with remote monitoring tools that yielded zero readmissions on that population. And so the clinical outcomes are working for the patient. But it takes that kind of outcome for the doctor in the practices to say, wow, this is actually producing
really
good
works.
outcomes. And then when you align the economic incentives properly, which we do, with the support of the delivery system and the payer, the doctors get on board. And that when the doctors get on board, things start changing. And so, for example, in all the markets we serve, we have community-based physicians, and they pretty much understand it and get it. We also have physicians that are primary care physicians that are employed by health systems. And so we've worked very, very closely with the doctors and the health system leadership to make sure the incentives or the compensation models that people refer to as work RVU models are amended in a way consistent with what the systems like, but incentivize these doctors to work within the system.
Right.
So these are learnings that take time to implement.
Right.
But at the end of the day, it's clinical outcomes. The doctors respect the clinical outcomes are improved, then they get on board.
All right, well, excellent, and what a fascinating role for you to be in as you evolve in this space for some of our health consumers who are most in need. So glad that you were able to join us here today. John, my name is Kate Warnock. Thank you for watching. We're going to be up next with another guest soon. Please keep watching.
Thanks, Kate.